The incidence of knee replacement surgery in India has become 3 or 4-fold more in the last 10 years. And why is that? It is because knee replacement is an extremely successful surgery, but when done right. Knee replacement surgery is considered as one of the most major surgeries of orthopedic surgery. It requires a long time for recovery and it requires a very good patient selection, because if your patient selection is not right, if the surgery is not done well, it can lead to many disastrous complications. Nowadays, what we are seeing that a lot of patients are suffering from knee arthritis, and as a result, because they are suffering from knee arthritis, they require a knee replacement surgery. The incidence of knee replacement surgery in India has become 3 or 4-fold more in the last 10 years. And why is that? It is because knee replacement is an extremely successful surgery, but when done right. And that is what I want to talk about today. Knee replacement surgery is considered as one of the most major surgeries of orthopedic surgery. It requires a long time for recovery and it requires a very good patient selection, because if your patient selection is not right, if the surgery is not done well, it can lead to many disastrous complications. So today we will talk about a few of them. Now let me give you the example of Mr. Sudhindra from Banshankari. Mr. Sudhindra came to me after 2 years of having done a knee replacement, where he said, "Doctor, I could walk better before the knee replacement than I could walk after, because my pain did not subside." When we checked his knee joint, we got an X-ray done, we found that the implant positioning was not correct. And when we talked to Mr. Sudhindra and saw his previous X-rays, we found that a knee replacement could have been avoided to a certain extent. So number one, please make sure that when you go to your doctor for a knee replacement, you ask them, are you actually a candidate for knee replacement, or will PRP or orthobiologics injections help you push the knee to the stage when you need a knee replacement? Number two, please make sure that when you get operated, the surgeon who's operating you has enough experience in knee replacement and has enough protocols so that you know exactly what is to be done. Coming on to my next example. Here I have Mrs. Veena, 65-year-old female from Jayanagar, who came to me saying, "Doctor, I'm looking for a knee replacement surgery, but whenever I go to a doctor, they all say, it'll all be fine, you can go and do your knee replacement." Let me tell you this, knee replacement surgery is a surgery, and with any surgery, there is a rate of complication. Have we reduced the rate of complication in the last 10 years? Absolutely. But with every procedure, there is certain complications that you must understand. If you are a hypertensive or a diabetic, the chances of infection for you may be higher. So the antibiotics and the post-op care is important. If you are a person with musculoskeletal diseases like Parkinsonism or muscular dystrophies, then for you, an implant which is more stable is more important. If you are a person who is not very active or who is a little overweight, then for you, you may require stems. Thus, when you go ahead with the procedure for knee replacement, make sure that you ask your doctor the following questions. Doctor, what implant are you going to use? What is going to be the life of the implant? Is there any risk that I have during the surgery? If those risks happen, what are the chances I can take, or what are the steps I can take to prevent it? And number 5, is there anything else that you want to tell me about the surgery that I may not be aware of? If you ask your doctor the following questions, I am sure you will be able to make an informed decision. Number 6, very important. What are the precautions I must take before the surgery, and what are the precautions I must take post-surgery? How is my post-operative rehab going to be, and what is the timeline that I will get back to normal the way I was before the arthritis set in? If you have these questions with you, if you ask these questions and you have these answers, it will help you make an informed decision. It will help you get ready for the procedure, because we see a lot of people who were shocked by the post-operative outcome of the surgery, who did not expect the recovery to take this much time. Now, in our practice, we are very clear about our patients that this is the protocol we follow, this is what we do for you, and before a patient even asks us, we give them all the information required. In fact, every patient of ours gets a handout where the post-operative rehab and protocol is clearly mentioned, so that if you miss my instructions, you know exactly what to do. This video is mainly as an informative video to you to tell you, is knee replacement surgery bad? Absolutely not. When done in the right patients, by the right hands, in the right settings, it is an extremely rewarding surgery. However, be wary, be sure, and make a decision based not on what your neighbors have said, but rather on what you trust and believe. Thank you.